Greetings. Welcome to In Conversation with Trevor, brought to you by Heart and Soul Broadcasting Services. I go beyond the headlines and beyond the sensational. Today I'm in conversation with Pediatric Orthopedic Surgeon Dr. Tongai Chitsamatanga, a consultant with CURE Zimbabwe. Enjoy this truly informative conversation. Dr. Tongai Chitsamatanga, welcome to In Conversation with Trevor.
Thank you, Trevor, for having me.
Dr. Chitsamatanga, I get the sense that you have found your passion in life. You have found your mission in life. You love children and you love helping children. Talk to us about how you found that passion and how you found that mission of yours.
Thank you so much, Trevor. It has been a very long road. I could even say that the passion started with just the love for medicine. As way back as when I was 7, I remember an uncle of mine asking me, "What do you want to be when you grow up?" And I think as most children my age at that time, they would say, "I want to be a doctor." And then he said, in a laughing way, that most children change because it's hard to become a doctor. And I told him, I'm not most children, and I'm going to become a doctor. And for some reason, I used to know that by the age of 19, that's when I get into medical school. By the age of 24, that's when I graduate. I just thank God that's how it happened. And then we did the internship after medical school at Perinatal Hospital between 2004 and 2006. And then later on went to a mission hospital.
Wait, let me just stop you there.
Yes.
I mean, you're at that young age, you already know what you want to do. Most of us, I think, don't even know what we want to do at late in life. Where do you think that inspiration came from, that I want to be a doctor, particularly given the fact that we'll talk about your background and upbringing? Where do you think that passion came from?
I think it was a combination of things. I think one of the motivational people was actually our family doctor. So we used to go there quite often, and I remember getting into his surgery, and then you sitting on the other side of the table, and then just looking at him and saying, "So what does it take to be a doctor?" And one funny thing I noticed with that particular doctor was he was quite hairy around around the back of his hands. And to myself, I said, okay, I think for me to become a doctor, I need to grow such hairs. Yeah, but I think
so. He clearly made an impression.
He did make an impression, yes.
Yeah.
And all the time we went there, I mean, you'd come out feeling much better. Yes.
And you work for an organization which, until we met, you were reminding me, we met at the Bulawayo airport.
Yes.
I think sometime last year. I didn't know that this organization existed. It's called CURE Zimbabwe and CURE International. Talk to us about what CURE does. You do such amazing work, and yet very few people are aware of the work that you do. Talk to us in the first instance, what is CURE International, and then what it does, and what is CURE Zimbabwe?
So CURE International is an organization that has hospitals in about 8 different countries, mostly in Africa. And the main focus is to assist the disadvantaged child, especially on the orthopedic side. But we also have children that have, for example, cleft lip. And then in one of the centers, they also assist children with spinal issues and also some with brain issues. So it is just aimed at assisting the disadvantaged child, and in most of the cases, is that child who society would shun because of their disability. And then CURE Zimbabwe started last year, so we're a year old. And our main focus at the moment is pediatric orthopedics, so conditions such as clubfoot, conditions such as osteogenesis imperfecta, where the bones are brittle and they break. And then we also have children that come in with bone infections. So sometimes you get children that are walking around with bones sticking out, and some cases like that. And from next year, we will be having a plastic surgeon who will be assisting us with the cleft lip, and then also some children with bone contractures. And all this is done for free, so the children do not pay anything in terms of consultation for the surgeries that they need to be done, and anything else that is associated with their treatment. So this has brought a lot of relief to the parents and also the children and the society.
Why the decision to locate in Bulawayo? Help us understand that.
I think it was after looking around, the government then offered the current location. This used to be a TB sanatorium, and then later on became hostels for nurses and doctors. And it then got burnt down sometime in, I think, somewhere in the 2000s. And so when the organization which started the hospital, called the Zimbabwe Orthopedic Trust, went around and then did the memorandum of agreement with the government, they were then shown this place and they fell in love with it.
And where exactly is it? Where are you located?
So we are located along the 12th Avenue extension, behind the United Bulawayo Hospital.
Okay.
Yeah.
And clubfoot. Describe what clubfoot is. I mean, it's a condition I'm not familiar with. I actually had to Google around to find. Describe what clubfoot is.
So clubfoot, it's a condition where the feet are turned inwards, and the child, for example, when say they get to walking age, they are not going to be able to walk on the sole of their feet. So they end up walking on the sides of their feet, and that's quite painful. And later on, they might develop problems around that foot. In most of the cases, we don't know what causes it, but in maybe less than 3% of the cases, it's associated with some conditions such as what's called spina bifida, which is a problem with the spine. So most of the cases we don't know what causes it. But what we know is the children that have clubfoot, which has not been treated, they face a lot of stigmatization in society. Some of them end up not going to school. Some of them just get locked up in the house because maybe the family is embarrassed for them to be seen.
Same with cleft lips, isn't it?
Yes, definitely.
There's a lot of stigmatization and the palate's condition too.
Yes.
Are you seeing lots of these people coming to you? Are they aware that the service is available and is available for free?
So in terms of cleft palate and cleft lip, we haven't yet started to offer the service.
I see. Okay.
But from next year, we are going to be offering it. And so definitely let the people know when we start that service. But clubfoot, we are seeing quite a lot.
Okay.
Quite a lot of clubfoot. Some who come in without maybe having been treated. And then we have others that come in after having been treated, but then they recur. Because there are processes to the treatment that one has to adhere to, and it needs a lot of commitment. 5-6 years of serial castings, putting plasters, trying to correct the deformity, and then wearing, initially, if the child is young, they wear what are called abduction braces. These are shoes with a bar in between. Or they might also wear what's called ankle foot orthosis, just to maintain the reduction that would have achieved from the serial casting.
And what condition are you finding you're dealing with most? Is it clubfoot? Is it bends? What is it that you're dealing with most?
It's mostly clubfoot.
Wow.
Then I think second to clubfoot, we are seeing patients with the osteogenesis imperfecta. what you could call brittle bone disease. So the history normally is that of a child who comes in with multiple fractures as they grow. So they can even start a delivery. If the delivery is be complicated as they deliver the child can break. And normally that's when maybe the parents notice that this child is a problem. And then we then see them at different ages. So what happens is, because the bone is not very strong, and as the child starts to put weight, the bones bend. And then they get to a point where they can no longer bend, and then they break. Yeah, and then that child, if they're walking, then they go back in terms of their milestones, so they regress. And it affects quite a lot of things. If they are going to school, they no longer can go to school. If they are older, the parents cannot carry this child because the child is heavy. And in some cases, the child will be in pain, especially soon after the break.
So for parents and viewers watching us out there, what do you say to them in terms of how to deal with these conditions and how to find you?
So to the parents, I think what I'd say is, now we have a place where we can assist the children. And, it's things that we can take for granted. But, when you look at some of the surgeries these children have or ought to have, they can cost as much as 3,000 US. And not most families can afford such surgeries. So with this coming into place of CURE Zimbabwe, it has taken away that element of the cost. Yeah, so what just needs to happen is, I guess, for us to go out there and get people to know that they can be assisted. They can also go even on the internet, on Facebook, we're there, and call the numbers, book for the patients or their children, and also maybe even go through their general practitioners and make appointments. And then we get to see them. Normally we have clinics on Monday and Tuesday, and then we schedule operations.
And it's all for free?
It's all for free.
No
cost,
no cost at all?
No cost to the patient.
Wow. How are you funded? How are you able to carry these costs?
So the funding is mostly from individual donors. So we have even some Zimbabweans in the diaspora, say just contributing £5 a month consistently. And then we have also some other major donors, individual donors in most cases. And normally what people do is they fund a surgery. And once you fund the surgery, it depends, on the type of surgery. And people just we are able to do more sometimes with money that's meant for one surgery. And I think the other thing is, with this is a public-private partnership between the government of Zimbabwe and the Zimbabwe Orthopedic Trust.
So the Zimbabwean government, the taxpayer, contributes to?
They don't contribute per se.
Okay.
But the area where the hospital was built was free of charge from the government.
Yes.
So again, I think that also takes away a lot of the cost to the patients. Yeah, so it's just mostly individual donors, but it's been quite supported.
So you say so there's this hospital in Zimbabwe.
Yes.
Where else do you have these hospitals?
So there's a hospital such as this in Malawi. There's another one in Zambia. So Malawi, Zambia, and ourselves do I think more or less the same thing, pediatric orthopedics. And then Kenya does pediatric orthopedics and the spine surgeries. And then we have one in Uganda, which then does neurosurgery. And then we have one in the Philippines and in Niger.
And you're all connected.
We're all connected.
Networked,
we are all connected.
And how large is the Zimbabwean operation, for instance? How many patients are you able to see? What's your staff complement like?
Okay. So on a weekly basis, in terms of the clinic, because I said we do clinics Monday and Tuesdays, we can see, I think, up to about 60 patients in those 2 days. And then Wednesday, Thursday, and Friday are operating days. And so we might, for those 3 days, operate up to about 20 patients.
Wow.
We don't operate or do clinics over the weekends, but we just come in and see those patients that we've operated on. And currently we got funding from the Tim Tebow Foundation to build a 40-bedded ward for the children. So that's ongoing. So that means that's going to increase our capacity. And next year when we get the plastic surgeon who does a cleft lips, then it means we are going to increase that. And again, that service is going to be free. Free to the
And
children.
your staff, how big is your staff establishment?
So we have 2 pediatric orthopedic surgeons. We have 1 part-time who is an adult orthopedic surgeon. He comes Mondays and then joins us on Wednesdays for theater. And then nurses, I think the staff complement is maybe up to about 20 nurses in the different departments, and then also other supportive staff.
So you do take adults too?
We don't take adults. It's just children.
Okay. You are also at a teaching hospital. Talk to us about how that is organized.
So we get trainees, orthopedic trainees that come in to be taught on things pediatric orthopedics. Normally they come in for maybe 3 to 6 months attachment. And we also get post-basic nurses that are doing nursing orthopedics. And they come in for about 4 weeks at a time. And most of them will be training at the United Bulawayo Hospital and then come in on attachment. And then we also have a program where on Zoom we get teachings to the different people around, the pediatricians, our orthopedic colleagues, orthopedic trainees, where we just discuss things, pediatric orthopedics, and then just to make sure that we improve, the quality of care and also improve the multidisciplinary approach to the patient.
If there's members of the public that are watching you, as they surely would be, how can corporates help? How can individuals help to aid this very important cause that you're working on?
There's a lot of ways in which they can help. But what I'd recommend is just to get in touch with us as a hospital. There are so many needs that we have. And I think our big aim is to have our local businesses and local people support us more so that this becomes self-sustaining. So yeah, I would encourage them to just get in touch with the hospital administration and find out what the needs are.
What are the needs? I mean, you have the opportunity right now to talk directly to the corporates and individuals. What are those needs?
So the needs are usually associated with the surgeries. So in terms of the things that we need to use for surgery. So normally our approach is that we say if individuals or corporates can fund a surgery.
Okay.
Yeah. So for example, we could say funding a full surgery is maybe $1,000 US. And if they contribute to that, then we are able to get some of the things that are needed, and we're able to do, some of the things that need to be done for the patients. So it's just, I think, mostly a monetary contribution, and then we, according to our budgets, because we have yearly budgets, and then we look for funding and then cover those budgets.
So in terms of equipment, you've got the equipment?
So equipment, as CURE International, they have a central procurement. Okay. So they've standardized all the equipment across the network.
I see.
So that it's easier to maintain. So if we've got, say, funding and say we want an operating table. There's a specific one that would then go for, and which is the same across the network. Yeah, so I think that's normally the approach that they've now gotten into.
And is the approach that you'll have one center per territory? And you are in Bulawayo right now. Any chances of expanding, or the Bulawayo center is enough for the country as far as your goals are concerned?
I think so far, in terms of the current setup, we're going to be probably just working around the Bulawayo center. One of the ways in which we then try to reach out more people is to go on outreach. So in April this year, we were in Harare, we were at Parinyatwa Hospital, and also at Salim Mugabe Hospital. And over the course of 3 days, we saw about 150 patients. And then some of them we then booked for them to come to Bulawayo for surgeries. And I think that helped because it also allowed, the people to be seen around their areas. But then I think for the safety then of the patient, we, in order to get good quality, we then bring them to Bulawayo for the surgeries.
One of the places that shaped you quite a lot is you after training, you spent time 2006 to 2012 at Mtambara Mission Hospital. That's where you discovered your passion for mission work. Talk to us about that part of your life and how it shaped you.
So Mtambara Mission Hospital was at a time when I was very young, 26. And just prior to going to Mtambara Mission, the government started enforcing a policy to say if you want to be registered with what's called an open practice certificate, you had to go to the district. And when you're young, you don't understand these things. We didn't understand it when the then permanent secretary, Dr. Mabiza, was saying, look, this in the district, that's where the need is. And when I remember,
I think didn't understand it is actually an understatement, because people went on strike.
Yeah, we went on strike, and we said,
you were fighting.
How can we go to the district? They don't want us to stay in Harare. We need to make money. But I got to a point, I think, when I realized that, look, for me to move forward, let me just go. Yeah. And the initial plan was to go for a year, which became 6 years. Yes, indeed, when we got there, we realized the need. They hadn't had a doctor for about 3 years prior to myself and my wife going there. And I remember they used to send the ambulance to Mtara, which is 80 kilometers away, 3 to 4 times a day. And around that time, you all know, the fuel, there was a fuel crisis around that time. And so it was very difficult for the hospital to manage. And so when we got there, then started offering maternity services. And at that time, again, as a country, we were, I think, at the risk of losing funding from the Global Fund. Because what the Global Fund does is, it says, you set your targets. So if you set your targets and you say we're going to treat 15 people in 1 year, and then you treat 5, it means that you were not faithful, if you could put it that way.
Yeah.
So they will not give you funding for other programs that come after that. So we ended up doing an outreach program, and what we call an accelerated program. We went out as far as Nyanga. I remember this other day we were sleeping on floor beds in one of the clinics in Nyanga, and examining patients and starting them on antiretroviral drugs. And then this other time we went to a mission hospital called Rositu. It's in Chimanimani. And as we were coming from an outreach, it was around 5, 6. We met a lady who was in a wheelbarrow, and they stopped us. They stopped our vehicle and said, look, we couldn't make it to Rositu. Please, can you help our relative? And I remember talking to my staff and saying, guys, what do we do? Do we just let this lady pass or we do something. So we agreed, look, we'll examine them, see how best we can assist. We counseled them. Then we started them on the medication. And then 3 months later, we went back for outreach. And a lady approached me and said, do you remember me, Chiremba? I was like, I'm so sorry. It always happens to us. You are expected to remember so many people that you see. And I said, no, I'm so sorry. I do not remember you. And then she said, I am that woman who was in the wheelbarrow, whom you saved after my relatives had given up. I think it was at that point, of course, with other things that had been happening, that I realized that I think my mission was beyond just myself, you know. And you realize, I think, as those things are happening, that could this be the reason why I went to the district? And I think, to me, the answer was yes, that was the reason. And then Mtabara mission in itself provided a family environment. I think it also helped that it was at that place where we got married with my wife, and then we started raising our family. It was a close-knit family, and everyone was always supportive of the other. So even as we then went back to specialize in Harare, already we had the foundation.
And so from Mtambara, you talk to me about your education, both before and after Mtambara, your specialization journey.
Yeah. So the specialization, I began it after the stint at the district at Mtambara Mission Hospital. And I remember when going through the phases that any doctor goes through in terms of trying to choose which specialty one can do. I remember at one time I wanted to be an obs and gynae, because I think we used to do quite a lot of cesarean sections.
Your wife is a gynecologist.
My wife is a gynecologist. So I think she beat me to it. And then at some point I wanted to be a physician, I think because of the experience with antiretroviral drugs. And then I nearly became a public health specialist, because just prior to going back to school, I got nominated to go for a trip in the United States, where they wanted to, there was an organization which just wanted to assist in the quality assurance in the HIV program. And the aim was that when we come back from there, then we would pursue that and work with the ministry. But then when I came back, one of the things that made me go into orthopedics was there were quite a number of accidents that would happen in the area because of the nature of the landscape.
Yeah.
And I saw that I was not equipped enough to attend to them. So it was an area of need. So that's, I think, that then helped in making the decision.
You went to Oxford University to do trauma and limb construction, and then you went to Derby University to do pediatric orthopedics for both for 1 year, one year each.
Yes.
That must have shaped you in a big way in terms of your career path.
It did. Prior to that, I had gone to Malawi to CURE Malawi, and I think that's where I then fell in love with pediatric orthopedics. And one of the things that I've learned in life is there's a statement which says you have to be in the lotto to win it. So I've said to myself, I am going to apply for opportunities, and the worst someone can say is no.
Yeah.
And you can never know that they'll say no if you haven't applied. So it's an opportunity that arose. We trained with what's called the College of Surgeons of East, Central, and Southern Africa. So they have an agreement or a partnership with the Royal College of Surgeons of England, where they support surgeons that have finished their training in country. And then they say, okay, what are the areas where you want help in, you know? And then you get an opportunity to then go and then you subspecialize in that area just to improve your capacity. So it was good in that you go into a system where the public health system works, and all you have to do is then focus on your work and make sure that whatever decisions that you're making are not related to the funds.
Right.
Yeah, you are not affected by whether a patient can afford
Infrastructure, financial issues, and so
yes,
forth. Yeah.
yeah. So it taught me that element of decision making without the other issues that can maybe affect one's decision. Yeah, so it was a very good time. And also the other thing is networking. So I then established relationships where I can just call a professor at Oxford and say, what do I do for this particular patient? Or what do I do with this particular condition? And it just improves the care of
the call to go to CURE Malawi, because that is what opened the door for you to be where you are right now. Talk to me about how that call happened.
So in 2013, the year I started my specialization in general orthopedics, there was a course at CURE Malawi, a pediatric orthopedic course over a 1 week period. So I then applied to go for that. And I think that's where now I was in this place where the patients were the same as what we were seeing at home, but the standards were quite high. And you could see the change in the children once they are treated. And I mean, you're coming from perhaps a helpless place where, yes, you do see those children, but then you are unable to do anything about it. And you don't know that actually things can be done to improve their quality of life. So I think that was it. That was what ignited the
interest
passion.
for
Yes.
you. Yeah.
And then in 2016, I then applied to go and do a year. There was funding for that. And it was wonderful because they let me do quite a lot of procedures.
So this is CURE that funded your training.
So it was CURE.
Wow.
Yes.
And I mean, would there be opportunities for young people interested to do the kind of stuff that you're doing as far as CURE funding is concerned?
There is. I mean, there is way more funding than just CURE. Because if you look at even the initial training as a doctor, there are a lot of people that if you just reach out, they will assist you. And then in the orthopedic training, there are other organizations within that also then assist. And CURE and its partners then come in when, for example, it's pediatric orthopedics or plastic surgery. For example, we once our plastic surgeon is in place, we'll have funding for a trainee who wants to do plastic surgery. Yeah, for that duration, it's usually about 5 years. Yeah, so with opportunity, you have to identify it, you have to apply. I don't think opportunity is going to come and knock at your door. You go and you knock at the door of opportunity.
You didn't have an easy life starting off. You lost your father, rather your parents were divorced when you were 9 months old, eh? And your dad took custody over how many of you? 4 or 5 of you?
Yeah,
four of you. And talk to us about that very tough upbringing. You experienced 5 stepmothers. Talk to us about that. I mean, you're 42 years old. You've done amazing things. You are a very successful doctor, passionate about what you're doing. But for people that are out there to say, your background is simply your background. It doesn't have to determine who you become. And here you are sitting here as a pediatric orthopedic surgeon who's been very successful. Talk to us about that upbringing.
I think in terms of that upbringing, because maybe I was young, it probably didn't quite affect me to I'm sure the levels that maybe it might have affected my older siblings. But the one thing that I thank my father for was he was very big on education. Yeah. So he would always tell us that you have to apply yourself, you have to work hard. There's never going to be an examination which is set aside for children whose parents are divorced, or maybe those that have the parents together, or maybe orphans. The exam is the same. And so I think from a young age, those are the things that he used to emphasize. And he also protected us, I think, from knowing why they divorced. Because, you know, when you're young, sometimes you then try and take sides. And we did communicate with our mother, and my mom passed away in 2005. We had a very good relationship. My father passed away this year in April. But I think the most important thing was the fact that he emphasized education. But not to say we didn't have any challenges, because I remember quite often we would be sent home because our fees wasn't fully paid. And one of the reasons that I then understood when I then grew up is he used to also take care of quite a number of his relatives. So it ended up having your resources spread over a number of people. And I think when you grow up and then you understand it, you then realize that, you know, it's actually something that becomes a strength. And with hard work, I think you get to wherever you want. I was never that kind of student who, I was never a top student. But one thing that I knew about myself was consistent in whatever that I did. I have quite a number of my primary school schoolmates who don't believe I'm a doctor.
Who never believed you'd be a doctor?
Yeah, I mean, even my elder sister still just laughs to say, we didn't know you'd become a doctor. But of course, you'd be like, I was telling you guys I would become one. Yeah, so I think just the hard work and the support from my parents, even though they were separated, I think they did emphasize, would say, work hard. And also, I think just getting to a point in your life where you have to make decisions. So I used to play tennis. I wasn't the best. But I decided, I remember in Form 3, saying to myself, say if I continue on the tennis route, is it something that probably will get me somewhere? So I had to be very realistic with myself. I still do play tennis now socially. It's a good social sport. But I think at that age, I realized that I wasn't going to maybe achieve as much as, you know, some of the people I used to play with. So I then said, look, I'm going to focus on the academics. And yeah, I think it has paid off. But it's all about the hard work. And I think, like you said, the background is there maybe as part of your build-up, but it's not meant to slow you down. It's not meant to be an excuse. A lot of people love the excuse. A lot of people will say, Zimbabwe is so hard. But then you find within the hard circumstances, you still find one or two people that make it. And it's not everyone who makes it through shrewd ways. It's people that also work.
Imagine getting free access to the Newsday, the Standard, the Zimbabwe Independent, and the Weekly Digest for a full month. Well, you can, and all you need to do is download the Newsday e-reader app on Google Play Store or scan the Newsday QR code in any of the AMH print publications and start enjoying the quality content. Usasaririrewe, famba ne time, famba ne chokwadi, famba ne e-paper.
So, Doctor, it's clear that you've worked hard and that working hard has paid dividends. You've been able to spot opportunities and you've been disciplined. But there's going to be young people. You are a born free. Hey? You are 42 years old.
Yes.
There's going to be a lot of young people that are watching us right now. We're going to say, but doctor, we work hard. We don't see the opportunities. We are disciplined. Hard work on its own in this environment is not going to pay dividends. What do you say to them?
I would say, maybe this might sound to be maybe inconsiderate, but I would say work harder. And then in working harder, you also need to work smarter. In terms of opportunities, I think opportunities, one creates opportunities. You need to start from what I call low-hanging fruit, and then I guess be able to really define what you want to achieve with your life. I think the biggest challenge that I see, especially amongst us the young, is sometimes we compare ourselves with other people whose journeys we are not aware of. And then we want to have it now, there and then. But I think that's never something that's wise to do. And with hard work, I think it should become a culture. It should become part of you, to a point where it's not painful, right? And like I was saying earlier on, that if you, with opportunity, you need to go and knock. But then do not think that when you knock on a door, you are going to get, the things that you want behind that door. There are some doors where you open and you discover perhaps the things that you really want are not there. So sometimes you need to close it, go and knock at another door. But I still feel that hard work still is a big part of the recipe. Yeah.
What you have been part of creating this institution in Bulawayo, CURE, which is doing amazing work, but it sits within an environment where medical institutions are dilapidated. I mean, the Bulawayo hospital organization, which is next to you, if you get in there, it's heartbreaking. Nurses complaining they're not paid well, doctors complaining they're not paid well, but much more importantly, also, perhaps not much more importantly, we're losing doctors and nurses to the US, not to the US, but to the UK, Australia, and New Zealand. What's your take of the working conditions of nurses and doctors, and generally the medical staff in this country?
I think it's a combination of just how the economy is. And I think it's not just nurses and doctors that are affected. But I think also one thing that we need to consider is, even within those hardships, you have quite a lot of nurses and doctors who are really working hard and providing the necessary care with resources that are available to them. I always try and look into how best we can assist each other. And one of the things that I normally encourage, especially people that have gone to the diaspora, is it is not good enough to just go and ignore and say, okay, I've left those hardships, and one continues their life as if everything is normal. We need to also then be able to realize that in most of the cases, our relatives are here. And how do we support the people that are on the ground? It's not everyone that's going to leave. And people have different reasons, to leave. Others have different reasons to stay. Yeah. And yes, we have got an issue with the resources, but I still just feel that at individual level, as the patient comes, we have to maintain our professionalism. We have to be able to then say, with what we have, how best can we assist the patient. I think what I've also realized in most of the institutions is, I think society in itself is also maybe helping in. Things are hard, but you find, if, for example, you go and the medication is not there, people end up having to go and buy that particular medication. Not everyone can afford, but and the thing is, at the end of the day, we have to work with what we have.
But you raise an important point there, which I thought I should go back to, which is, I wish we all pitched in every day and gave our best with what we have. But that is not what happens in terms of the service that the public is getting from doctors, the service that public is getting from hospitals and from nurses. That's a big problem, isn't it?
No, it is. I think what we'll need to just do, maybe as a profession, or even as people generally, as Zimbabweans, is to be able to still maintain that human element in whatever that we do, be it if you're a banker, be it if you're, we have to maintain a certain level of maybe professionalism.
But that human element is gone, doctor.
It's gone.
And
yes.
I want to admit that it's not just the medical profession alone. It's all across the board. We've lost that human element, haven't we?
Yeah, it's very, very true. And it's, I always say it's very easy, you know, to lay blame. I could lay blame on you and say,
Absolutely.
Trevor, you did this, you did that. And I think it's very easy to even lay blame on the government and say the government did this, did that. But then there are still certain things I believe that go beyond all those institutions. Why should your character be changed, you know, by what the government is doing? Why should your character be changed by what Trevor is doing? Why should you not be maybe the beacon of hope for the person that comes in? Because, you know, sometimes what, especially in our field, what the patients require, worse off, I mean, we deal with families. A child comes in with 3-4 caregivers, you know, and sometimes all they want is to be listened to, right? Sit there, you listen. What are your problems? How can we assist? Because I think in pediatric orthopedics, there are so many cases where we end up not operating. So it's not every case that is operated on. But I think it's when you then get to sit with the caregivers and the child to explain to them why maybe you are getting to that decision, and then letting them also be part of the decision.
I think people will push back. People watching will push back and say, yeah, circumstances do change people. But I hear you. That's not justification for not being human, for being loving. But we've been changed by the circumstances in this country.
True.
Let's go back to your formative years in your education. Which schools did you go to?
So for primary education, I was at Riverside Primary School in Gweru. We used to stay 2 minutes away. And then did Form 1 and 2 at Thorny High School. Then went to Milton High School from Form 3 to Form 6, which is in Bulawayo. Yeah, I mean, if I look at even just the different schools, one of the key issues, like I said, I've always been hardworking, but rather unfortunate in all the classes that I've been, I'm put in with people that are quite brilliant. So, but that just helped me to push my standards up. I always remember, and my dad used to always remind me of our motto at Milton High School, which says, quit ye like men. I'm sure now it's quit ye like people, because we of gender balance.
Yes.
Yeah, but I mean, that in itself, I think just helped. You realize these things when you grow up to say, okay, this is where the foundation was laid.
Well, what's your, I mean, you at 42, you already have this big responsibility. What's your sense in terms of the way you're touching people's lives with the work that CURE is doing? What changes are you seeing?
For me, the impact goes beyond my CURE days. Because prior to CURE, there's a time I worked after finishing the general orthopedics. After having done the year in Malawi, I worked at Paranato Hospital. And then I would see these children that, you know, needed to be helped. I knew what I needed to do, but because of resources, I couldn't. I remember quite a number of them, giving them my number and saying, look, I don't know how and when, but just keep my number. Be in touch, will help your child. And now quite a number of them now have come in now with CURE and reminded me, Chiremba, you remember we met at Parinyatwa, and you just realize the impact is just beyond. You see the happy faces, you see, like I remember this other child who had a condition called chronic osteomyelitis, where the bone is sticking out, and the bone, there's a piece of dead bone there, and they couldn't go to school for the past year because the smell was just so much. Yeah, so we then took them to theater, cleaned everything up, took the dead bone out, closed the wound, and then seeing them 3 months later walking in, wound is healed, very happy, and the parent quite happy and saying, now I know my child is going to school. And then the other thing is, we are a Christian based organization.
Really? I didn't realize that.
Yes. So we have a spiritual department, and they also go like even on outreach, just spreading the word about ourselves, but also offer counseling services to the families. And this is not to say that we treat Christians only, no, but I think it then offers a holistic approach to the parents and the families. And yeah, I think the impact then goes beyond just the physical, spiritual, and what we've seen in terms of the spread of the message. It is the families that have been helped that spread the message more. So you get children that come in and say, I heard from my neighbor. I saw my neighbor's child walk. So I know my child will walk. Yeah. Even in circumstances where you know that, okay, with this particular condition, this child won't walk. You're able to break down the news, you're able to assist them, and a lot then walk out of that consultation room satisfied and knowing that if in the event that they need to ask something, we are there for them, and we are there for the kids.
Fantastic. It's an encouraging story. It's an inspiring story, particularly for parents out there who have children that have these conditions. And we wish you all the best with what you're doing. And I'm sure there's lots still out to be done. Talk to us about, books that you've read that have changed the way you think and the way you look at the world that you'd want our viewers to read. What books do you recommend?
So from an early age, I used to love reading Shona books, and then just going into the story and trying to live it. And then, of course, now there's one book that I've gone to, and now it starts to make sense. There's one by Giles Kuimba, Tambaoga Mwanangu, and I think it was published in 1968. And you see the dynamics, especially of the African family, how sometimes you, especially in this background where perhaps you're working hard, but sometimes you work hard and people can wake up and say, no, it's not hard work, it's gobblings and all those things. Yeah, so that's one book that I've read, and especially rereading it, it's just to make sense, and it's just encouraging. It's saying you should have confidence in yourself. You should have direction with yourself. At the end of the day, it's your responsibility to make things work. Then the second one is Becoming by Michelle Obama. Again, it's one book that tells a story from humble beginnings. I look at it, even this opportunity that you've afforded me, I remember asking myself to say, am I really worth it? When it dawned on me that you really wanted me to come and speak, I was like, what story do I have to tell? But then, when you then look back and you realize that, look, sometimes because we live that life, we don't really see the impact that we have. And so if you read Becoming, you see how the former First Lady, Michelle, rose, but from a very ordinary family. And if maybe someone had looked at her at that moment in time, they wouldn't have predicted that she was going to be the First Lady of the United States. And then the third book is 5 Languages of Love. It's by Gary Chapman. So this one, I really encourage people, especially couples, to read it. But not just couples. There's also, I think, one way also focuses on like the relationship with the children. You realize that people have different ways in which love means to them. So for example, you could be a person who, for example, if I am to express my love for you, you expect gifts. Then you've got other people that might be people that just want to be thanked. And then you have also other people that, you know, just do stuff and perhaps don't want to be thanked.
Expression of love.
As expression of love. And then there are other people that, you know, so it's different ways in which you can express love to the people that you, but you have to understand them. Because if, say, I bring a gift and that's not your love language,
they won't appreciate it.
You might not appreciate it because you'll be like, yeah. But if, for example, if I am a giver, right, and maybe expect to be thanked, then I bring a gift to someone whose love language is not of gifts, then it's most likely I'll be offended because this person didn't understand. Yeah. So even within families, even with the kids, like I've got 3 boys and they are different. My eldest, he wants you to be there. He wants that active attention. My middle child, I think by virtue of being a middle child, is very independent. And then the youngest, I think, is a combination of
we're all different, and your story for me, again, is a story that says anything is possible. Because if one looks at your life and the way where you started off, like you're saying, your sisters laugh at you and say, we never thought that you're going to be a doctor. I sense something in you that I can't exactly touch or feel that's going to continue to propel you to heights. So we wish you all the very best, Doctor. And thank you so much for driving all the way from Bulawayo to come for us to have this conversation. We wish you all the best. We wish CURE and the wonderful work that you're doing with our kids to continue doing that wonderful work. Thank you so much.
Thank you so much, Trevor, for having me.
Thank you. Allow me to tend to our viewers who are all over the world. Thank you for tuning in every Monday at 7 a.m. Central African Time. Remember to subscribe. Press this red button to subscribe, like, share. Visit our website, Convo with Trevor. Remember, we've also gone a step further and created podcasts. Those podcasts sit on our website, and they're all over the main podcast platforms for your listening pleasure. We read all your comments, your suggestions as to who should come on the show, and we thank you for that. Until next time, cheers to you all.